What causes capsular contracture in breast augmentation recovery? Imagine your body's natural response to a foreign object like a breast implant. It forms a layer of scar tissue around it, called a capsule. Sometimes this capsule becomes too tight, squeezing the implant and causing discomfort or distortion. This is known as capsular contracture. It happens because of an overactive healing response that leads to excessive scar tissue formation. Several factors can trigger this process. One common cause is inflammation from trauma during surgery or bleeding around the implant, known as a hematoma. When blood collects in the pocket where the implant sits, it can cause inflammation that promotes thickening of the scar tissue. This thickening can tighten over time, making the implant feel hard and sometimes painful. Bacterial contamination is another key factor. Bacteria, especially types like Staphylococcus, can stick to the surface of the implant and form a slimy layer called a biofilm. This biofilm protects bacteria from antibiotics and immune cells, leading to persistent low-grade infection. The ongoing presence of bacteria causes chronic inflammation, which encourages the body to produce more scar tissue. This process is considered a major theory behind capsular contracture development. The body naturally reacts to the implant as a foreign object, forming a fibrous capsule around it. In some individuals, this reaction becomes exaggerated, resulting in excessive scar tissue that tightens around the implant. If the implant ruptures or silicone leaks, the body may interpret this as injury or irritation, leading to further inflammation and thickening of the capsule. Certain patient factors also influence risk. People with a genetic tendency to form more scar tissue, autoimmune conditions, or those who smoke are at higher risk. Radiation therapy to the breast area can also increase the chance of contracture because it promotes fibrosis or tissue thickening. The type of implant and placement method matter too. Smooth-surfaced implants, especially those placed above the muscle, and silicone-filled implants are associated with higher rates of capsular contracture compared to textured or saline implants placed under the muscle. In summary, capsular contracture results from a complex interplay of inflammation caused by bleeding, bacteria, implant rupture, or individual immune responses. This inflammation triggers the body to produce too much scar tissue, which tightens around the implant, causing it to feel firm, distorted, or painful. Understanding these causes helps plastic surgeons develop strategies to prevent and manage this complication during breast augmentation recovery. Always consult with a qualified healthcare professional for personalized advice and care.